there are people who come from far off villages and all that do not have access to medical care, and they cannot really approach a specialist doctor to consult about their problems. So it is those kind of people that we usually see, and the problem is not just confined to cough, cold and all. They come with chronic problems for which for some sort of follow-up is required. I am Dr. Nishmita. I'm an internal medicine specialist based in Bangalore. I've been associated with MediBuddy since 2019. It was during the second wave of COVID. We had such a deluge of cases there during that time that the consultations would go on till 11:30 in the night. So a young man once approached me saying that his father is not well. So he said that his mother has recently passed away in the hospital due to COVID. He also had symptoms, so did his father. So he had the psychological stress of losing his mother and on the verge of maybe something bad happening to his father as well. I got a certain basic medical test done because in the teleconsultation platform, we are not able to physically examine the patient. So whatever parameters we get to know about his health is from the investigations. So the investigation showed that his inflammatory markers were high. So, and he had also borderline saturation. He actually needed admission in the hospital. So when I conveyed it to him, he said that he's kind of having a PTSD sort of a thing, going back to the hospital and having to deal with the death and devastation there. So I told him, see, there are certain risks involved, but then you can do certain things at home which will help you in treating your father. So first thing would be you have to start oxygen for him and get monitoring of these particular blood parameters at this distance of time. He was started on antivirals and all of his treatment took place at home, and I'm just so happy to say that he not only didn't have to go to the hospital, but he improved well at home, his saturation improved, and the patient was really happy by the end of it, because this unheard entity just a few years back had helped him treat his father at home, had timely care, which his mother unfortunately couldn't get it in a hospital also. So that was a moment where I felt really happy and grateful for the profession and also for the platform. Concept of teleconsultation is a newer entity altogether. We are having access to patients even from the distant rural population, which don't even have a medical hospital or a dispensary for that matter. Not just their problems are solved in just a phone call. We do not know what kind of medicines they're getting there. So sometimes the prescriptions that we get from there, it gives an idea as to what sort of treatment is going on in the periphery. And we get an insight as to how to treat them better based on their cultural or social background. So in that way, MediBuddy has really helped in bringing India closer.